Hello, warriors, healers. Happy Monday. And this is a quick reminder that we are still taking participants, right, for the 3-day Bowel Rest Bootcamp. I'm calling it a bootcamp because we're going to go hard, um, resting our digestive system, decreasing or eliminating or prevent gut issues. So for me, I'm doing it because I'm setting up my foundation for the next holiday to come. So even if you feel like you have no gut issues, you have no gas, no bloat, no constipation, like your gut is perfect, which is never the case. We all have room for improvement. We all have work to do when it comes to having a perfect gut. This program is for you. So when I do this, as I mentioned in previous videos, I'm doing it because I am resetting my system after a holiday, after a vacation, after an event, or I might do it because I ate something and I'm feeling slightly full because fullness is not the feeling that we want to have. We want to be satiated, not full. And I want to kind of prevent this uncomfortable sensation of feeling from getting worse. So what are the benefits of the bowel rest? The bowel rest. Okay, so first you have to decide why am I doing this? Because it is quite an intense process, but one that is very beneficial, one that is effective for you to acquire. It's a skill that you're going to learn that you can use forever and ever, so that you can be in control of what's going on in your body. Learning how to do it safely and effectively, because we're going to do it together, which I'm going to be guiding you so you'll be able to bring any concerns, any questions, any wins, any celebrations in our Zoom meetings. And also in our chat section, there's like a whole chat. I'm going to be monitoring myself, Ty, Miami, and also Marilyn will be monitoring the chat. But mostly me, because I have quite a few people that are not in my programs that are joining, so I want to make sure that I'm supporting them. But the benefits of bowel rest is to prevent, again, eliminate, restore, reset, heal the gut. So when I said the gut, I am talking about your stomach, your small and large intestine, your liver, your kidneys, like the whole organs that are located in the midsection, right? Your abdominal area, you can call that. We call that the gut. But also the gut starts from your mouth as well too. So when you rest in your digestive system, you also rest in your mouth, because you're not chewing a lot, you're not chewing the food. You're actually pre-breaking it down by blending it, by juicing it, by the smoothies, and then your mouth doesn't have to go to work like we're doing now. And it is so important to every so often give your gut a break. I mentioned before how we go on vacation. If you work for someone, we have a day off. For your gut hasn't had a day off for a long time, for a very long time. So it is so important that you do that, because not only you are giving your cells, your organs extended time for healing to take place, like extended time for healing, but you also decreasing the stress on your digestive system, because every time you eat a hard piece of whatever, whether it's the meat or the carbs or the fat, like avocado or so, you are putting your body to work. So when you give it a break, at the same time still feeding your cells the nutrients, it's a perfect combination. We don't think about these things until they stop working, right? You don't think about the health of your gut until you start having issues. You're like, oh my God, I'm bloated. I have SIBO. I have SIFO. I'm tired all the time. And then you go into doing the work to restore your digestive system. So for me, when I do this, it's not so much I want to spend 3 days of drinking my food. Okay. I mean, that sounds like a little it's because I am preventing certain things from happening to my body. It's because I want to make sure that I am always optimizing the organ, that section that's been working for me. Because your gut is everything. It is the portal for illness, it is a portal for disease. And many of us don't think about that. We take that for granted. I know I did. I know sometimes I do. I take it for granted. Not only we go through life feeding it a whole bunch of things we're not supposed to, right? We feed it like a whole bunch of toxins, and of course, it's not intentional, but we really don't really step back and say, okay, what do I need to do to restore my gut? How can I give this section of my body, this part of my body, some TLC so that it can work for me better? There's always room for better. There's no perfection. There's no perfection. So when we think like we are healthy and then we take a step back, oh, I'm healthy. I take a step back and doing the same thing that you used to do that got you to being sick or disease and have discomfort. That's what's been happening. That's how we get these famous name conditions diagnoses, we call them, because we really don't think about things that we need to improve. We don't take a self-assessment, right? We don't do a self-assessment to see what do I need to improve to get my gut to work the way it is. At the time I'm recording this, it is November 22nd. Okay. And Thanksgiving is right around the corner. And then Christmas comes, and then New Year's come, and then all the holidays come, and then New Year. Like there's so much. There's so much happening. Many of you, including myself, will be doing some unhealthy eating. Although we do want to be mindful, we don't want to just use this as a crutch to just go and just eat unhealthy, right? But even the healthy food has contaminants. And there's going to be a lot of overeating happening right now, this season, this time, right now, right? Because we're all going to be together. We're going to, have socialize with loved ones. We're going to have great companies. So it's it like people celebrate each other through food, right? Like people actually use food as a means of celebration. You wanna go out for dinner? Food. You wanna meet up for lunch? Food. I'm having an event. You want to come over? Food. The game is on, right? Like the football game is on. What's going to be happening when the football game is on? Food. So we use food as a way to connect with each other. So if that's the way you connect with your loved ones, your family, then I highly recommend that you take into consideration how much work you put in your gut through and actually do some things that you like just love on your gut. I love on my gut. I love on my gut. Everything happens in the gut. Disease, illness, healing, inflammation, the immune system is in the gut. Neurotransmitters are produced in the gut. You want to have more energy? Focus on your gut. You want to don't stop losing your hair, right? I got a lot of hair loss in my practice. You want to balance your hormones. Everything is in the gut. And I tell patients so often when they come to me with a skin rash, they be like, well, Dr. J, I have acne. And it's in my face, it's in my back. But I'm like, okay, when they give you the Accutane, right? This is the famous medication for acne. Or they give you spironolactone, or you get the birth control pills. Where are you putting that? Where are you where are you putting that? You putting it in your gut, right? It's like you're going into your gut. So it is so important. And that's why I'm so passionate about this because there are things that you don't know that you don't know. And I've gone through years of research. I've been practicing functional medicine for 10, 11 years now, and I've been in the medical field for almost 20 years. I know I look young, but I'm one of those people that I excel in school, right? I have a curious mind and I like to learn and implement. So my years in the medical, like if you were to talk to any of my colleagues in the hospital days, they would tell you that woman, me, she's going somewhere. Because I'm the lady that would just get down. I'm like, okay, what do we need to do? Let's just look it up. Let's do the science. So this process that I invented, okay, it's not one that's gonna waste your time. It's not. Because I love to eat and I don't want to starve. I use food as medicine 80% of the time. So therefore, if I'm feeding myself medicine every day, healthy dose of medicine, then I'm gonna find ways to do it in a way where I'm also catering to my gut to get the benefits that I want. So decrease inflammation because you're not chewing a hard piece of food, you actually getting the nutrients to the cells the most way they can absorb it, which is pre-broken down. You're gonna boost your immune system because this food, they have vitamins in them. Did you know that? Vitamin C, you can find vitamin C in peppers. Yeah. So there's a lot of food in here, which I'll be doing more smoothies because there's a special smoothies I'm gonna make with drug fruit and passion fruit, like I get from Whole Foods. So I'll be doing more smoothies and add it here. So there's so many things, right? and then improve digestive system. So if you are bloated, you'll see less bloat. If you are gassy, you'll see less gas. And because I really take into consideration of removing many of the foods that are producing gas. I do. I'm like, okay, broccoli, we don't want that. For me, it gives me a lot of gas. So if you know there's a food that's part of the meal plan, because I'm giving you guys everything that you need to make this successful, minus the supplements, because again, this is a program that I created for myself and also have been guided my one-on-one patients through. This is part of the protocol. Like they pay me the money and I give them everything so they have access to all of my things here. But for you, you're gonna need a multivitamin, you're gonna need something to help you go to the bathroom, which I recorded a video and I added here. So there are some videos already pre-recorded here. If you're watching this, there's instructions. So everything is already set to go. I revamped this whole system here to make it more effective, easier to implement, because I want you to do this every single quarter, after every single holiday. This is not something you do in one and done, like I do this and I'm done. This is something you can do all of the time. I have patients that I helped years ago when they sending me messages like, Dr. Genty, blah, blah, blah. I'm like, did you do a 3-day bowel rest? I'm like, they said no. I said, well, go ahead and do it with a virus. There are two things you should be doing, two things that I do on the regular every year. I do my 3-day virus and I detox every quarter. Now, the 3-day virus I might do more often because if I'm traveling a lot, my gut is like, okay, help. Don't worry, gut. I got you. I'm gonna help you. But the detox every every 3 months, my friend, like I'm not even going to think about it. I'm doing my detox. So that's how we're able to have beautiful skin. My hair's growing like crazy. I like my hair. I had to like my hair because of the growth. I didn't have time to maintain it because this is more important to me. So I prioritize things in my life. My skin is beautiful. I have acne scars. People will look at me, they're like, you had acne? Yes, I did. I did have acne. But if you really look closer, you can see some of the scars because, I used to pick my acne and put like acid on them. Anyway, that's another video. So my gut, like I'm not bloated. I'm not bloated. I'm not bloated at all. And then because I'm going through perimenopausal successfully with no issues at all, I have no symptoms. I used to have symptoms after I gave birth to my baby. My baby girl, she's 3. I got pregnant at 41, give birth to her at 41, so at 40. So postpartum depression was anxiety was my name. And I didn't know any of that. I didn't know how to I didn't know. So people didn't tell me. So I had to go on this journey of resetting and rebalance my hormone. And I used to get so bloated. And I'm like, wow, I'm the gut doctor. What is happening? Because my hormones are so imbalanced. But my gut, because I focus on my gut, I did my detox, the bloat wasn't that severe. Like you can see a little bit. But it wasn't like I was bloated 10 years ago when I just started this journey. So what do we do to keep ourselves healthy? We pay attention to our body. We do the things that many people are not gonna do. We do the things that 90% of the population is not doing, right? Which is this. Like how many people you know is doing a 3-day bowel rest? I don't know about you. I don't know any. We have to do a 3-day bowel rest. This is for you to take with you. Now, if you're part of my community, if you are a patient of mine, you get this complimentary because it's already in your program. But if you're like, oh my God, I'm so interested in this, I would love to have my hands on these things and then go on this journey with Dr. Genty and her patients, then it's $100. If you're interested, there's a link. We can send you the link to pay. But I'm telling you, $100 doesn't do this justice. Doesn't do this justice for the amount of like tools and the resources and the support accessibility you're gonna be doing. It's $100. And why did I charge $100? Because I want you to really pay attention to this. Like I detest giving people stuff for free and they just take it for granted. I used to do this for free. I did. I used to do this for free, but I used to do it only for my communities. People that would come to me, they say, well, I don't have money and I'm still bloated. I'm like, oh, I'm doing a 3-day bowel rest with my patients. You want to join? Then I'll bring 5 people in because it's not fair for my people, for my patients to pay that much money, and then for them to get like people that's not in the program. So, but sometimes I will give this away because I do a lot of giveaways. I do a lot of donations in my life, in my practice, a lot. If you're a patient of mine, you've gotten something from me, you know what I'm talking about. Even if you're not a patient of mine, know that part of me being healthy and wealthy and abundant and prosperous is because I give. So this is a gift to you for that $100. You paid $100 because I want you to have skin in the game. I want you to be like, okay, I'm paying $100, although you might be paying $100 and do nothing. It's really up to you. But I really want you to be like, I am doing this. And it's gonna be together as a group. And if you need to sign up before Wednesday, if you sign up before Wednesday, then you are gonna get some pre-work preparation. I'm gonna have my patients do certain things on, I mean, two things on Thanksgiving Day. So then you can have access to that if you sign up before Wednesday. If you don't sign up before Wednesday, then you're not gonna have access. You can still join, but you're gonna come at a later date. You're not gonna have access to what we need to do on Thanksgiving Day. All right. So if this is you, you're like, I love this, Dr. J. I want to participate this. Please reach out. Let's do this. It's only $100. You have nothing to lose. You have nothing to, yeah, you have nothing to lose. It's $100. And if you know me, um, I go above and beyond and I give and I give and I give. So $100, you get all the tools and the resources. We have a few videos already recorded here on, Practice Better. You're watching the app here. I have an instruction how to do this because again, I want you to do this every time you need to after the holidays, after a party, after a vacation. And also you have all the recipes. And then if you join by Wednesday, which is the day before Thanksgiving, you're gonna have the preparation. I have a special tea that I make for myself and I drink all day Wednesday, aside from eating the food, to kind of set my digestive system. And I also put a few documents, like a few information, the importance of the two ingredients that I use in the tea for you to see. As you can see here, that one of them is like boost immunity, it good for oral health because your gut starts in the mouth. Your gut starts in the mouth. So as we're drinking the tea, we're also addressing this piece of our health. You can see there's a lot of things, cardiovascular benefits, and it's antioxidant. So I have this in there in the module, in the portal already for you to kind of start learning to see why I pick certain ingredients to make my specialty. Again, the thing that we do to keep us healthy the thing that we do to keep us healthy, 90% of the population is not going to do this. Okay? $100, you have access to us, to me. I'm going to do it as a group. It's going to be a community. There's a chat section here. I'm going to be in the chat, answering any questions, staying motivated to kind of show you guys the process that I do to keep myself healthy and flat belly and also low, high energy, low inflammation to continue having my gut work for me on demand. That's what this is. And this is the skill you're going to have with you forever. Again, you pay $100, you have access to this. You can print it down, print it out. You can print it out and you have access to it and implement it whenever you want. All right. So if you join before Wednesday, I'm going to put a video here to give my participants the preparation they need to make on the day of Thanksgiving to kind of set the foundation so that they can have less bloat. And then the week after, that's when we're going to start our 3-day Bowel Rest Bootcamp. So you actually have access to this way before we start because there's certain things I want you guys to do. And I'm going to be in the group. And then you get 2 Zoom meetings with me, 2. And at one of the Zoom meeting, I'm doing a whole webinar talking about the importance of bowel rest because I want you to see how it is so vital to include this piece into your health journey. So, and then if we do it again, when I do it again, because I usually do it once a year, then you can join us. All right. So this is for you. If you're looking for something to kind of help you be proactive, practice preventative medicine. If you're looking for something that you can do at home that doesn't require a lot, like you're not paying $100, you're not paying money for this. It's not a program that you're paying thousands of dollars. But this is a skill, that a knowledge that you're gonna acquire forever. You can implement forever. This is what I do to help me be this person that I am today. Healthy, yes, I am healthy. I'm so glad to say I'm healthy because I've worked so hard on my health. And this is the thing that many people are not doing, right? These are the things many people are not doing. That's what they are not getting the results that we all have right now. So if that's you, the link. Now, if that's you, you can send us a message or you'll see the link wherever I'm posting this. And I would love for you to join me and see how I care for my patients and just do it at a very low cost. Okay, so that's it. I hope you find this video to be valuable, and then you know exactly what you can understand what I'm talking about, how it is important for you to take matter into your hand and be in charge and be in control and in charge of your health. And if this resonates with you, you want to join me? Awesome. If not, then I want to wish you a very happy Thanksgiving. If we can support you with anything else, please reach out. Until then, have a great rest of your day. See you guys on the next video.